What is measles? Measles is a highly contagious viral disease with serious consequences, including hospitalization and death. Before the mid-1970s, it was widespread in Australia until vaccination was introduced. In 2014, Australia achieved measles-free status, but occasional outbreaks still occur due to travelers bringing the virus back. Measles, also known as rubella, spreads through the air via talking, coughing, or sneezing. Vaccination is the best protection against measles. Despite the vaccine's availability, declining immunization rates have led to recent outbreaks, especially in the United States. Low vaccination rates worldwide increase the risk during international travel. Measles should not be confused with German measles rubella. What are the symptoms of measles? Measles symptoms usually appear about 8 to 12 days after being exposed to someone with the virus, but sometimes it can take up to 21 days. The most common symptoms are a high fever, feeling tired, a cough that sounds like barking, red or bloodshot eyes, and a runny nose. After a few days, a red and blotchy rash will appear on your face and spread to the rest of your body. This rash lasts for about 7 to 10 days. Other symptoms may include a sore throat, white spots in your mouth, and muscle pain. What does the measles rash look like? The rash starts out as flat red spots on your face and then moves downward to cover your whole body. Then, smaller raised white spots may appear on top of the red rash. The spots might join together as the rash goes down your body. Which virus causes measles? Measles is caused by a highly contagious virus called morbillivirus. It spreads easily through the air when an infected person breathes, coughs, sneezes, or talks. If you breathe in the particles from someone who has measles, you can catch it too. These airborne droplets can linger in a room for up to 2 hours even after the infected person has left. Measles can also spread through sharing drinks or food, kissing, shaking hands, holding hands, hugging or touching surfaces contaminated with the virus, and then touching your mouth, nose, or eyes. Pregnant individuals can pass the virus to their babies during pregnancy, delivery, or while nursing. What are the complications of measles? Measles can lead to many complications, and some can be very serious, especially for certain groups of people. Babies and toddlers, pregnant individuals, adults over 20, and those with weakened immune systems are more likely to experience complications. These complications may include diarrhea, ear infections, pneumonia, and encephalitis. Pregnant individuals with measles may also face pregnancy-related issues such as low birth weight or preterm birth. Before vaccines were widely available, about 400 to 500 people died each year from measles. How is measles diagnosed? A healthcare provider can usually diagnose measles by asking about your symptoms, doing a physical exam, and looking at the rash. Sometimes they may need to do tests to confirm the diagnosis. These tests involve taking samples of blood, secretions from your nose and throat, or urine pee to check for the virus. How is measles treated? There's no cure for measles, so you have to let the virus run its course, which usually takes about 10 to 14 days. You can help manage your symptoms by taking acetaminophen or NSAIDs for aches, pains, or fever, getting plenty of rest, drinking lots of fluids, gargling with salt water, and avoiding harsh light if your eyes hurt. It's important to stay home from work or keep your child home from school to prevent spreading measles to others. Usually you can return to your normal activities after having the rash for 4 days. Remember, never give aspirin to children or teenagers unless your healthcare provider specifically tells you to because of the risk of Reye's syndrome. Can you prevent measles? Vaccination is the most effective way to prevent measles. If you get the measles vaccine, you become immune to the virus and are unlikely to ever get sick with measles. There are 2 types of vaccines, given as shots that protect against measles, the measles, mumps, rubella MMR vaccine, and the measles, mumps, rubella vermicelli MMRV vaccine. The MMRV vaccine also protects against chickenpox. How measles affects your body. Measles affects the body by attacking the respiratory system, causing inflammation in the airways and lungs. The virus enters the body through the respiratory tract and spreads rapidly, leading to symptoms such as coughing, sneezing, and congestion. Measles also weakens the immune system, making the body more susceptible to other infections. Additionally, the virus can cause widespread inflammation throughout the body, affecting various organs and systems. This can lead to complications such as pneumonia, encephalitis, brain inflammation, and severe dehydration. In some cases, measles can be fatal, particularly in individuals with weakened immune systems or underlying health conditions. Overall, measles can have serious and long-lasting effects on the body's health and well-being.